my name is Sophia Vale, and I'm a fourth-year pharmacy student at the University of Connecticut School of Pharmacy and Pharmaceutical Sciences. Today, I'll be walking you through a blog post I wrote working with Dr. Jennifer Gerardo, clinical professor. This blog post is titled Infant Botulism, Evidence, Presentation, and Pharmacist Considerations. It is a review of recent CDC investigations of infant botulism outbreaks and treatment with botulism immune globulin. You can find this blog post on the UConn School of Pharmacy and Pharmaceutical Sciences website under the Pediatric Infectious Diseases and Immunization Update blog series. Historically, infant botulism has been considered a disease associated with honey exposure or environmental sources like soil and dust. However, we're unfortunately now seeing a new concern as recent investigations by the Centers for Disease Control and Prevention have linked powdered infant formula to 2 multi-state outbreaks of infant botulism. The first outbreak, which the investigation is now closed, involved By Heart Whole Nutrition infant formula and resulted in 48 confirmed cases of infant botulism across 17 states between December 2023 and November 2025. The most recent outbreak is still ongoing and involves Nara Organics Whole Milk Organic Infant Formula. As of July 6, 2026, 4 cases have been reported across 3 states. Ingestion of Clostridium botulinum spores by the infant leads to the germination and production of botulinum neurotoxin, leading to a descending flaccid paralysis. Infants often present with constipation. This is different than the difficulty swallowing, blurred vision, and double vision, which are often early signs in older children or adults. Because infant botulism is a clinical diagnosis, treatment should begin as soon as it is suspected and should not be delayed while awaiting laboratory confirmation. Both the CDC and American Academy of Pediatrics recommend immediate treatment with botulism immune globulin. This works by neutralizing circulating toxin in the blood, preventing additional nerve damage. Consultation with the California Infant Botulism Treatment and Prevention Program determines eligibility and coordinates the release of the medication. Clinical studies have shown that botulism immune globulin improves outcomes. In a 5-year, randomized, double-blind, placebo-controlled trial, infants treated with the botulism immune globulin had shorter ICU and hospital stays, required less mechanical ventilation and tube feedings, and incurred lower hospital costs. Following up this trial, researchers conducted a 6-year nationwide open-label study. This demonstrated that treatment within the first 3 days of hospitalization resulted in shorter hospital stays compared to delaying treatment until days 4 to 7. From a pharmacist's perspective, timing of preparation and administration is a very important consideration. Botulism immune globulin requires reconstitution with sterile water. This step can be expected to take about 30 minutes. The infusion should be started within 2 hours of reconstitution. And the 50 milligram per kilogram dose is administered at 0.5 milliliters per kilogram per hour through a dedicated IV line with an 18 micron inline filter. Patients should be monitored for infusion-related reactions. One important counseling point to emphasize is avoiding aminoglycoside antibiotics when possible, as they can worsen neuromuscular blockade and increase the severity of paralysis. There is actually an unfortunate case report describing a 5-month-old infant who received gentamicin for presumed sepsis before being diagnosed with type A Clostridium botulinum infection. They unfortunately died shortly after the first antibiotic dose. Another important counseling point is to delay live vaccines like MMR and varicella for 6 months after treatment with botulism immune globulin in eligible infants because of passive antibody transfer. Here are the references used in this blog post. Thank you for watching this summary of infant botulism within the Pediatric ID and Immunization Updates, a partnership between the UConn School of Pharmacy and Pharmaceutical Sciences and the Pediatric Pharmacy Association. To learn more, please go to the full blog post with the link that can be found in the description of this playlist. If you found this video interesting, please be sure to like, follow, and subscribe to the University of Connecticut School of Pharmacy and Pharmaceutical Sciences channel in our playlist. Have a great rest of your day. This information is for educational purposes only.